Welcome back. When we talk about symptoms, a lot of times we expect that, oh, it might just be our age, or it might just be that we slept funny, or we might just have done X, Y, or Z, fill in the blank, right? But I'm here to kind of help you rethink that concept a little bit. So, one of the favorite things that I like to say is just because it's common doesn't in fact mean that it's normal, right? And so whether you, let's talk about PMS or pregnancy or when it comes to hormones in general, right? We have almost assumed that if you're going through puberty, you might have X, Y, and Z symptoms associated with it. Or if you're going through pregnancy, you might get morning sickness, or you might get low back pain, or you might get heartburn, or if you're going through postpartum, that you might lose some hair after a few months of your baby's arrival, or that you might have postpartum depression, or that you might have any list of symptoms, right? We can often say that, oh, that's okay. That's just normal because you are in X phase or you are going through X thing. Or as we get older, we just assume that it's okay that if you get arthritis, like, oh, that's just a part of getting older. So I like to make the distinction here that it's not just about the age or the phase of life that you're in, because while it might be really common, if it was in fact a quote unquote normal symptom or a normal experience, that means everybody in that phase or that age or that experience of life would be going through the exact same things. So if we talk about PMS, it would mean that everybody going through puberty would have acne or would have back pain or would have headaches or whatever that might look like as part of their monthly cycle. Or for boys, it's actually a 24-hour cycle. And for pregnancy, it would mean that every pregnant woman would have morning sickness or, any time of day sickness, or fatigue or heartburn or food cravings or food aversions. That would be the case for everybody across the board. Or if you're going through postpartum, that everybody would lose their hair. Everybody would have trouble losing the weight. Everybody would go through postpartum depression. Everybody would have insomnia. All of these things would happen to everybody then. Or as you get older, that you would definitely have arthritis or dementia or all of the things that are so common in our society, but not normal. One of the things that we talk about with our practice members is what are the things that you can do to help break these cycles of these common symptoms that you might be experiencing, and how do we create a foundation of health? Because as a chiropractor and as a functional nutrition practitioner, it's really, really tempting to have somebody who comes into your practice to say, I'm experiencing X, Y, and Z symptoms. And then as a practitioner to say, oh, this is how I can help, right? And say that we can do chiropractic adjustments, or we can look at what you're eating and how you're digesting it, and we can look at your nervous system regulation to help improve that. And we can do all of those things, but if the goal is to use that approach to put a holistic band-aid on something instead of perhaps an allopathic band-aid, or just ignoring it or waiting for it to go away on its own, whatever your version of the band-aid is, if we can actually work on strengthening the foundation so that you can actually have better adaptability and compensation that's taking place, as opposed to your body constantly putting out these little fires. If we can make a better roadway or make a better path for your body, then we have a much better foundation for the body to come back to. So then these little fires don't feel even as big as they might when the body's constantly doing that. So another way of thinking about this is that when we're under stress, and remember, stress can be different types of stress. It's not just mental emotional stress. It can be physical structural stress, it can be nutritional chemical stress, and or mental emotional stress. And there might be other factors laid in there, but I kind of lump that all into one of those three categories. But if we were always under stress, then the body's nervous system regulation is really, really, it's difficult to regulate. It's kind of like if you imagine the being on the road, and if there's constant emergency vehicles coming along, then you are consistently parked on the side of the road, right? And you're just waiting for them to finish coming through. But if it's periodic, then you can pull over for a moment and let them pass, and then you can cut back on the freeway and get to your destination. So, similarly for our bodies, if we're always pulled over trying to let these emergencies get taken care of, then we don't really get to our destination, or it takes a really, really long time. So, similarly, if you can think about helping your body to help regulate its nervous system, this is what we do with all of our practice members, is setting up a healthy foundation so that all of these little stresses don't add up to create symptoms that might appear normal but are in fact just common. If that's interesting to you, or if you'd like to learn more, please check out the link below and how you can participate in one of our courses to help strengthen the foundation for your health and your family's health and well-being. Thanks for joining us. We'll see you next time.